Okay guys, thoracic extension is one of the most commonly limited things I see in the clinic, and it's really hard to dissociate shoulder flexion from thoracic extension. So I'm going to show you two ways. One that does not include the shoulders, which is kind of harder to assess, but if you have a really keen eye on identifying limitations, you might be able to see it. And then there's another way that works with the shoulder, and then that one's just a little bit easier to have people do on their own. But it's not as specific to just isolating the thoracic extension component. So the first way is going to be in a kneeling position. You're going to cross your arms and you're going to be here. Now, try not to move anything else but the upper back, and you're going to just extend. Okay, now if you can get your upper body a little bit higher than your lower body, then that means that you have adequate thoracic extension, because this part is fixed into lumbar flexion. So you know you're not compensating with the lumbar spine for this, and you know you're not compensating by using your shoulders because the shoulders aren't even used in this component. That one's pretty hard to determine, right? So the better way is on the wall or in down dog. So down dog's component is here. You can see that there's a slight amount of thoracic extension right here going on. But if people have limited hamstrings and calves, then this position is probably not going to work for them, right? Okay, so it's a really good idea to look at your shoulder flexion before you're looking at thoracic extension, because we already know that I have about 180 degrees of passive shoulder flexion, right? So anything beyond 180 degrees, if I can get my arms further up, that's not coming from the shoulders anymore, because passively I can only get 180 degrees. So now the rest of it's coming from my thoracic spine. So that's why it's important to do the shoulders before the thoracic spine. So this one's easy. You're going to be about eye level with your hands. You can also be about shoulder level, anywhere between there. And then you just walk your feet back a little bit, have people push in the wall like they're doing a handstand, drop their chest, and then seeing if they can keep their elbows straight, how much thoracic extension they can get into. And you can see all the thoracic extension taking place right about there. And I have quite a bit more than 180 degrees, right? Because my arms can get way above my lower body. So I'm like this, which means I have adequate thoracic extension, but not a lot of people do. Okay, now to work on controlling your active mobility of your thoracic spine, I like people to be in child's pose if they can. If it's okay on their knees, I prefer them to be in child's pose, and then they can maintain that lumbar flexion and then just work on. Or they can be out here and do one at a time. Or they can be in quadruped and do one at a time. Or you can be on the wall, the same way we just assessed it, and then just lift one arm up and then the other arm up. And that's just simple ways to start learning how to control that mobility.